Hello everyone, Dr. Boyd here. Welcome back to Parently. Today we're talking about preparing for pregnancy. So what I'd like you to do is pull up a cup of tea or a cup of coffee. I have coffee because I'm a coffee guy. And I'd like you to think about 9 specific points that will prepare you for an upcoming pregnancy. It's important to remember 50% of women prepare for pregnancy, 50% of women do not. That means that a large amount of women, we're talking to you, prepare for pregnancy. 9 points. This is not an all-inclusive list, but these are 9 points that I think are very important for you to prepare for pregnancy. Pregnancy point number 1, interpregnancy interval. 18 months, that's the magic number. That's from the end of one pregnancy to the beginning of the next pregnancy. Pregnancy interval less than 18 months increases the chances for that second pregnancy to have problems, specifically preterm birth. We don't want that. So if you have your optimum measurement months, it's 18. Those women that have Irish twins, that's 2 babies born within a year. So a baby born in January, 9 months later, born in October, those women tend to have more problems than if you wait 18 months. Planning for pregnancy point number 2, body mass index, BMI. I encourage you right now to go to ask Google what your BMI is. Now, the BMI calculator on Google, you can find one that uses pound and inches, but some of them use kilograms and centimeters. When you calculate your BMI, we want that number to be less than 35. The heavier you are, or the shorter you are relative to your weight, your BMI goes up. We know that obesity is the #1 health problem now in America, especially in reproductive women. BMI greater than 35 increases your chances dramatically that you're going to have problems with pregnancy. Specifically, increased risk for hypertension, that's elevated blood pressure, increased risk for diabetes, increased risk for stillborn, that means your baby dying inside, increased risk for cesarean section. If you have an option to lose weight by exercising and decreasing your calories to get your BMI less than 35, I encourage you to do that. So planning for pregnancy number 3, nutrition, water, and caffeine. These are not in any specific order, but we're going to talk about 3 relational issues for you in an upcoming pregnancy. What is the optimal amount of calories? 1,600 to 1,800 calories per day. If you have a BMI of over 35, and I just addressed that, you need to decrease your calories less than 1,600 calories. But a normal reproductive woman should have a calorie intake of approximately 1,600 to 1,800 per day. When you become pregnant, you need to increase that by 300 calories. If you nurse, you need to increase it by 500 calories. Water. I encourage you to drink water. I want you to go out right now or get on Amazon and order a cool water holder. This is a Hydro Flask. It's blue. That doesn't necessarily mean if you drink this, you're going to end up with a baby boy, but you might. If you buy a pink one, maybe you'll end up with a baby girl. But I want you to drink water, 60 to 100 ounces per day. May as well get in the habit of it, because when you get pregnant, you need to drink water. Why? Because you increase your risk for problems like kidney infections, bladder infections, even potentially preterm labor if you don't drink enough water. Caffeine. Now I'm drinking a cup right now. I like caffeinated. My screen says I like caffeinated, but you don't want to drink too much caffeine. You may as well get in the habit of it now, because when you're pregnant, we want you to have 2 cups of coffee or tea per day or less. That's about 200 milligrams. That's the max. We do not recommend that you drink soda. It has a tremendous amount of sugar. People often relate and say, how many cans of soda can I have? Well, I don't want you to have any. Why? Because of the sugar. And then the diet sodas have aspartame in them. Even Coke Zero, we're a little bit concerned about, could this be a negative for your pregnancy? Encourage you to think about what you're going to do when you get pregnant. Exercise, pregnancy plan number 4. We don't want you to start exercise when you get pregnant. We want you to start exercise before you get pregnant. What is an optimal amount of exercise? That's everybody's guess. But if you simply walk 30 minutes per day, swim 30 minutes per day, run 30 minutes per day, do that 3 times per week, we feel that is a minimum amount that you should perform and carry that into your pregnancy. When you get pregnant, we don't want you to start that. It increases your chances for problems such as shortness of breath and other issues. We do know that if you exercise throughout pregnancy, you lower your cesarean section rate. Planning for pregnancy point number 5, medications. Are your medications safe? The FDA quantifies medications into categories that potentially can cause birth defects: A, B, C, D, and X. We feel very comfortable that medications that are categorized as an A are safe for your pregnancy. We know for sure that medications that are category X are bad for your baby. We want you to be informed prior to getting pregnant whether those medications are A, B, C, D, or X. Please talk to your healthcare provider. Planning for pregnancy point number 6, folic acid. Very, very important to decrease the risk for neural tube defects in your baby. That's something called spina bifida. It's where the spinal canal doesn't form correctly. We know that folic acid preconceptually decreases neural tube defects. 300 to 400 micrograms is what is recommended. However, let's be safe. Let's simply take 1 milligram of folic acid per day. Your prenatal vitamins will have folic acid in them, but I always encourage women to take extra. So take your prenatal vitamin, take your folic acid every day, preconceptually. Vitamins, specifically prenatal vitamins. Many women are on vitamins, but I want you on a prenatal vitamin. Watch this. Look at that. That's how fast you can get a prenatal vitamin. You simply have to go to the drugstore. You can go to Walmart. But it needs to say prenatal vitamin. And it needs to say this every day. In other words, you need to take this every day. You're going to take this pre-pregnancy, you're going to take it throughout your pregnancy, and you're going to take it after your pregnancy. Buy whatever you like. This one's got a pretty emblem. That's fine. Buy that one. Buy something you like. Buy something that tastes good. Buy something that doesn't make you nauseated. You may have to try 2 or 3, but it's okay. Take one of these every day. Planning for pregnancy point 8, vaccines. Very controversial subject, not only in my family, in many families, many healthcare providers. What do we do? Do we take vaccines? Do we not take vaccines? When do we take vaccines? This is a very personal decision. The FDA, American College of Obstetrics and Gynecology, has their own scientific evidence of what they recommend for vaccines. I highly encourage you to talk to your healthcare provider before you conceive. Let me give you an example. MMR, mumps, measles, and rubella. You received that when you were about 5 years old. We thought that it was a lifetime immunity. We now know that rubella, many women in their reproductive lives are not rubella immune. That means if they get rubella, which is German measles, they get sick. So if you're not immune, we recommend the vaccine. ACOG recommends the vaccine after your pregnancy. But again, if we're talking about pre-pregnancy planning, you can take that before you conceive, 3 months prior to conception. But you don't know unless you get a blood test. And it will tell you if you are immune or not immune. Please talk to your healthcare provider. The flu vaccine. It's now recommended that every American take the flu vaccine. When I started practice, it was only for high-risk individuals, but now it's for everybody. And you get that in September or October, all the way through March. It's important that you talk to your healthcare provider. Do you have questions? Remember, the flu vaccine is an educated guess of what strain of the flu is going to infect us this coming winter. So it ranges in effectiveness against the virus 30 to 60%. So that means a lot of the flu vaccines that come, the flu vaccine does not help. Planning for pregnancy point number 9. This only involves a small percentage of you women listening to this video, and that's genetic screening. It's important though, if you have a family history or you have a personal history of a baby that has had trisomy, in other words, genetic abnormalities, should you be evaluated through genetic testing? That's something that you need to ask your family members so that you get a good history. Please talk to your healthcare provider on whether you are a candidate for genetic testing. 9 points. These are not all inclusive. These are helpful, but I encourage you to follow these 9 and then develop any further information, any questions that we at Pearently can help you with. Move forward with empowerment of being pregnant and knowing the information that will help you as a healthy woman.